We are now 2 years into COVID-19. We've seen doctors and other medical providers on the front lines working to protect us.
Healthcare, no question, is a priority and is convenient for a lot of us here in Hampton Roads.
But in Northeast North Carolina, it's a completely different story, with some folks having to drive across county lines or even state lines just to see a doctor.
News 3 investigator Zach Dahlheimer takes a look at medical deserts here in our backyard.
Gates County, North Carolina, an area along the North Carolina-Virginia state line where 10,478 people call home.
Come up front, please.
Including Emily Truman and her 4 kids.
It's where I grew up and where I've hoped to raise all my kids.
Among the white picket fences, post offices, and water tower, for Truman, one thing's missing.
It's 45 minutes to a hospital. It's 45 minutes to anything.
No primary care doctor, pediatrician, or any physician.
So I have moved my care to Elizabeth City, which is about a 45 to 50-minute drive to that doctor.
So what do you do when 45 minutes doesn't work?
You pray. And you drive fast.
She recalls one time when her 7-year-old daughter had severe stomach pain.
We ended up going straight to CHKD, which, you know, is over an hour to get to, and we would not have done that with a more local physician.
In data from UNC taken in 2019, Gates County was one of 2 counties in the state with 0 physicians of any kind. This includes primary care, OBGYN, pediatrics, and urgent care medicine.
There's 100 counties in North Carolina, so 2%, the bottom 2% there is not a good place to be.
I've been in the car with a broken arm before on the way to Suffolk going through all the railroad tracks.
Leslie Small came back to her hometown of Corapeak after graduating from NC State to be close to family. Whenever she needs a checkup, it's across the state line at Centera Obici Hospital in Suffolk.
I'm very privileged. I have a car, I have gas money. I'm able to get to things outside of our community.
We took the drive ourselves from her front door to her doctor's office, just less than 35 minutes one way in good weather and no traffic.
Something where I'm like, oh, I need antibiotics today. I call the doctor, hope I can get in, take off work, make up my hours later at night, and then come back and keep going.
Let's go back to the data from UNC. This breaks down the number of physicians from more than 50 specialties across the state. Now, taking a look at other counties in our area, Camden had 1 physician, Perquimans had 5, and Currituck had 8. Now, that's compared with other counties such as Dare with 64 physicians or Pasquotank with 112.
It's a substantial problem.
Dr. Saif Khairot studies health data at UNC. He considers Gates County a medical desert.
A county that does not have a primary care physician or practice can be considered a medical desert.
That is not a recipe for overall health in this country.
Dr. Eric Wallen has been looking for solutions to this issue, working with community health groups as well as people at the state level and at UNC to deliver more access to health care.
With funding, we might be able to dream someday of bringing a mobile health clinic that does have its own hotspot for internet access, so to speak, so we can have both physical and virtual appointments for patients in those communities.
He and Khairot believe other solutions are training providers to serve their home communities and more opportunities for telehealth given its rise in the pandemic.
An established physician that people can know, because I feel like the comfort of knowing your physician is also important.
As for Small and Truman, they'll continue making the drive for doctors, but hope to eventually get more care closer to home.
Just because we live out in the middle of nowhere doesn't mean that we all don't deserve equitable access to health care.
We also reached out to Albemarle Regional Health Services, the health department serving 8 counties across Northeast North Carolina. They tell us while limits in providers and health professionals in rural counties remains a concern, they look to a regional care model and integrated health to help their communities access needed health care services. The agency has also bought and installed telehealth equipment at each local health department in the region. Zach Dahlheimer, News 3.